Good morning, everyone. Thank you for being on time for this week's staff huddle. Before we begin, I'd like to confirm attendance. Ms. Fare,
Present, ma'am. Good morning.
Dr. Basalo,
Here, ma'am.
and Ms. De La Peña.
Present, ma'am.
Okay, great. So let's begin our briefing. I'd like to start with the concern raised last night in Ward 1A, a near miss involving an incorrect insulin dose. Fortunately, it was caught in time, but we must stay vigilant. This highlights the continued importance of strictly following the 10 rights of medication administration. Miss Fare, your thoughts?
Okay, thank you, ma'am. I recommend that before each medication round, especially during busy shifts, nurses do a 2-minute check of MAR entries, particularly the PRN meds. It may seem small, but a brief pause to recheck details can prevent serious harm.
Good point. And documentation accuracy is just as important. We often forget that even routine meds can be risky if we're rushing.
I agree. Last night, I had two patients with similar last names. I paused and verified their wristband and ID numbers twice before administering any meds. It me down a little, but I think it was worth it for safety.
That's exactly the kind of initiative we want to encourage. Thank you for that, Ms. De La Peña.
All right, so moving on, our latest hand hygiene audit results are in. Overall, the compliance has dropped to 78%, which our goal is at least 90%. So the most commonly missed moments were before touching a patient during the shift transitions and handoffs.
Yeah, sometimes we forget when rushing to indoors or respond to calls. Um, Maybe we need visual cues in high traffic areas as reminders.
That's a good suggestion. Dr. Basalo, do you have materials ready?
Yes, ma'am. So I'm currently preparing the digital posters and simple reminder cards. They'll be placed near the patient room entrance, the nurses' stations, and the med rooms. I'll also email the copies today for the group chats and the bulletin boards.
I think visual cues will help, especially for newer staff like me. Sometimes we overthink tasks and forget the basics like hand rub before and after glove use.
Okay, thank you, everyone. We all need reminders sometimes, and supporting each other is part of good teamwork. So there were some recent concerns about incomplete shift endorsements, particularly regarding high-risk patients. This affects the continuity and quality of care.
Yes, I've noticed that too. I suggest we adopt a checklist for handovers, covering vital updates like the IV lines, new medications, pending lab results, and any changes in patient behavior or condition.
A checklist can improve consistency and we can keep it simple, just the bullet points. We can review quickly during the shift change.
That will be helpful. After night shift, I feel exhausted and worry about forgetting important info. A checklist would give me more confidence during an over.
Good feedback, and I'll draft a template for endorsement checklist and share it in our chat. We'll try it this week and gather feedback by Friday. And a few quick reminders. First, always follow PPE protocols strictly, especially when entering isolation rooms. Second, the new duty roster will be released tomorrow. Rotations have been adjusted based on your feedback.
Also, everyone, please dispose of the used PPE properly. We have two incidents last week where used gloves were placed in the regular bins. That's a serious risk. So let's keep the working environment clean and have a clear workflow.
Yes, and let's remind our float nurses too, especially those rotating from other wards. They may not or they might not know our specific stations.
Noted. I'll make sure it's mentioned during their briefing. Okay, everyone, thank you for your cooperation and active participation. Your input helps improve our workflow and patient care. Let's continue to support each other and maintain safety standards. If you have suggestions or concerns, feel free to message me privately. That concludes our briefing, and have a safe and productive day ahead. Meeting adjourned.
Thank
Thank
you,
you,
ma'am.
ma'am.
Thank you, ma'am.